That is a great question. So, physical therapy is a health science profession in which we focus on improving function, physical function for people across the lifespan. So, we essentially help people to move better. We deal with patients who have a host of acute or chronic illnesses. We have the goal of trying to help people fully recover and regain function. And if that's not possible, to be functional with assistive devices or in whatever they need to move in a new and different way.
That was a great way to answer it. The next question is, what does being a PT mean to you? And we'll kind of go down the line for each panelist, and we can start with Pam again, and then we can work our way down.
Well, being a physical therapist to me means that I get to treat people very holistically and that I get to impact the lives of not only the patients that I work with, but their families, their caregivers, other people that they're affiliated with. So I feel like I'm giving people hope and helping them to maximize the quality of their life. And it's very rewarding.
Amazing, thank you. Chloe?
Yeah, I would say helping patients to regain their function and their independence in their day to day. And like Dr. Bosch said, improving their quality of life. You definitely get to know your patients no matter what setting you're in. You get like more time with them, I'd say, than a lot of other professions. So it's really rewarding to get to tease out some of the little things that were maybe missed and kind of, share that with their care team or help them heal from that, whether it's like pain or more of a functional impairment or, yeah, like Dr. Bosch said, using a new assistive device, a whole host of things. It's a very wide of a profession for sure.
That's great, awesome. And then David?
Yeah, so with the caveat that I'm not a PT yet, um, I think one of the things that was probably the most inspiring about PT is that you really get to see um, a patient through the lifespan of whatever injury they're going through. So to me, being a PT is being that constant in a specific season of change for someone, post surgery, post injury, workers' comp, anything like that, where you're going to be the person that's like, okay, I have all this going on, but I know I can go and talk to my PT about it and at least get some kind of security in that.
Awesome. And then Maya?
Yeah, kind of piggybacking off of everybody, but what David was saying is like we get to see them at their absolute worst, and then we get to play a role in seeing them at their potentially their best or their new best. And I just think that's super unique with us is that like we get to see them through that whole continuum of care. Um, and we see them multiple times a week versus where they're not necessarily getting that same kind of attention or devotion from other healthcare professionals simply because they don't have like they don't get that access or that time with them like they do with us. I really value the connections that I build with my patients, like even working as a technician. I love working with them, seeing them, getting close to them, and I think that's something that's unique to our field specifically.
That's great, thank you. Another question that was submitted was, what does the day-to-day of a physical therapist look like? And I think this question was for Chloe.
Yeah, I think it really depends on what field you're working in. You can work with pediatrics, you can work in a neuro outpatient clinic, in a variety of inpatient settings, orthopedic, home health. I just encourage everybody to talk to a different PT in each setting because I think it just makes a big difference. But my day to day as a home health physical therapist, which means I obviously go to people's homes. And so I will usually wake up. I have my little morning routine. And with home health, you can definitely be a little bit more flexible. You set your own schedule. So there's more time involved in scheduling your patients, but you do get some more flexibility in that if you have a doctor's appointment, or if you happen to have kids or something, you can take care of that in that way. But so I wake up, have my breakfast, I work out, and then I drive to my first patient, spend about an hour with them, and I see a big variety of patients in home health. It could be someone that just had a knee replacement, and they live far away from a clinic, so they need help at their home. It could be someone recovering from a stroke. It could be someone that has had Parkinson's for decades. A lot of times it's just people that are homebound or have not a lot of access to medical care in some way. See my first patient about an hour, spend a little time doing documentation after that, and then go to my next patient, and I see between 5 and 6 patients a day, just depending, since there's a lot of documentation that goes into home health. So you spend a little bit more time on average in that setting, just explaining what you did, what your goals are for the patient, making a plan for the next session. Just really depends on who you're seeing. Then I come home and live my life and then repeat again.
Awesome, thank you. And then a follow-up question was, what does a day-to-day of a PT student look like? And then this is directed towards Maya and David.
Yeah, I can take that first. So it really depends on the day. Maya and I are going through 2 separate iterations of the same program because they're changing kind of how we approach that. So for us, you have class 5 days a week, but what you do on each specific day kind of changes with the class. A lot of times we're doing a lot of open lab during the class time where we're actually with all of our students. And so I wake up, same thing, work out, try to eat, often forget. Coffee's my best friend. And you go to class, you spend a lot of time with your professors, with your classmates. I don't know about Phoenix, but at Flagstaff, we have recess. So we'll go out on like the quad and throw various balls at each other. And after that, usually we have a lot of time to either work on stuff asynchronously. So like any kind of homework that we might have, any kind of exams or studying we might do. We usually do that together. You couldn't pay me to stay away from my classmates at this point. And then, yeah, rinse and repeat 5 days a week.
Yeah, I wish I got recess. If I were to go outside during lunch, I would melt. It's still wicked hot here. So maybe when it cools down, we have like a little lawn area. Some of us like to take like a little picnic blanket out and have lunch out there. So that's nice. Um, my schedule, like class-wise, is obviously going to be like a little bit different than David since I'm a second year and like we had kind of a curriculum switch. Um, but same kind of thing, start 8 a.m. Typically, I'm done with class by 4 at the latest most days. And now I'm getting into more of like the clinical rotation side of things. So that's been exciting. I'm in different clinics, inpatient and outpatient, once a week. Um, so it's been cool getting to see different environments that I haven't really been exposed to in my observation hours before starting school. That's kind of like the new development. But other than that, I'm in class basically all day. Half the day is going to be lecture, and then the other half is going to be lab, just depending on like what topic I'm going through for the day.
Awesome, thank you so much. This next question is for Dr. Bosch, and the question is, can you incorporate nutrition or health coaching into the career at all?
So I would say yes, with a little caution that so a physical therapist is a licensed healthcare provider, and we have a scope of practice. There are skills that we're trained to do and that we're legally allowed to do, and other things that are not within the scope of our profession. So you're going to learn about nutrition, and obviously some of you have a passion already for that from your undergraduate degree. And of course, you can talk about that, but you're not making meal plans or kind of medically related nutritional recommendations to your patient unless you're also a licensed dietitian or nutritionist, because that is not the scope of our profession. But again, because we treat people so holistically, that will come in to, the extent that it's acceptable. And you'll know what that is if you go into physical therapy and learn that profession. And life coaching really is, trying to think of, I think it's a part of, again, treating the whole patient and being sort of mindful of your patient's goals, working collaboratively with your patients. So it could incorporate that, but it would not be the focus. You wouldn't bill a patient for doing that. You're billing them for the strengthening and kind of reteaching motor control, those sorts of things, if that makes sense. And if you students want to add or provide any insights based on your experience, jump in. And Chloe, actually.
Yeah, I agree with you. I think it's a fine line because you want to help your patients, and obviously, like if someone, like a lot of my patients are diabetic, and so it matters what they're intaking, obviously. And so if they go into like a low blood sugar or high blood sugar, you can maybe like educate them on how to prevent that from happening, or just like general principles of nutrition. But yeah, like Dr. Bush was saying, you you don't want to put your license in trouble by advising things that aren't covered in our specific, practice, scope of practice, which we learn about in PT school. So don't worry. But yeah, definitely room for that. And having knowledge about that will certainly help too.
Awesome, thank you. And this next question is for Chloe, since you are currently practicing and doing this every day, is what advice do you have for someone looking to pursue a career in PT? And anyone else can feel free to hop in as well.
I would say, especially if you're, an undergraduate student right now before going to PT school, I would say just keep an open mind and try to have fun with it. Try not to take it all too seriously. It's obviously really important to learn about the different career options out there for you. Like I said before, there's so many different areas of PT. I would try to explore all of those as much as you can, and maybe just ask, a friend of a friend that you know who's a pediatric PT to shadow for one day. Just, try to go into it with like a sense of curiosity and wanting to learn if it's something you'll like, and not just stressing about hours and experience. Obviously, that is important too, but just know it's a big commitment going into grad school, and just make sure it's something that you're passionate about, and try multiple settings to see if it is for you. Because everyone has their own little passion and niche, and just enjoy the process.
Awesome. Does anyone else feel like they want to pop in to that question?
Yeah, I just kind of want to echo what Chloe said. I feel like when I first started, feels like a lifetime ago now, kind of scary. But when I first started, I was very caught up on like, okay, this is like, you have to be super serious, you have to be very disciplined, like you're gonna be spending your whole life now is just like studying, preparing to pass your boards, do well in your clinicals, and like be able to be a functioning physical therapist. But as I like eased in, I got to like understand my studying habits more. I got to like just kind of settle into all my classes. And then I realized like, no, I'm taking myself way too seriously right now. And then I started to have fun. I love my classmates so much. Like you see them more than you see your family. Um, so they become like a secondary family and they have just been crucial to my success. Like we help each other with study materials. And then we can also have fun and hang out outside of class hours. And I just feel like soaking that in and not just getting like, oh, you got to study, study, study. Like, yes, obviously you have to do that and kind of like lock in when it's closer to exams, but I'm finding myself enjoying it more, learning all of the things, but also just like looking at it from like a whole, like holistic perspective instead of just like being so hard on myself. Cause now it's like the fun stuff. I got into school. Now I get to enjoy it because this is what I want to do with my life. Like it should be fun. It should be exciting. So
That's great. Thank you. And it looks like we have a question in the chat. What kinds of internships did you do? And did anyone take a gap year before attending PT school?
Oh yeah. Oh yeah. So in my path to PT school wasn't not super untraditional, but it wasn't super traditional either. I flipped which healthcare career I wanted to go to 3 times before I settled on PT. Um, I remember there was this old professor who said, "Don't get your toes wet, get your legs soaked." When it comes to healthcare, it's like just try everything, see what sticks, see what doesn't. So before I got into PT school, I worked for athletic trainers. I shadowed surgeons, and I worked for a physical therapy clinic. I took 2 years before or 2 years off after undergrad to do that. And if taking a gap year is something you're considering it, I liked it. I liked it a lot. I think if I came right out of undergrad, I would have burnt out very quickly. If you want to go in straight after, that's completely your prerogative too. But I think that the experiences that I got in those 2 years after undergrad were completely invaluable. I got to see a lot of really cool stuff that I've very recently applied. Like yesterday, we had a practical. I remember doing the exact same thing to one of my patients one time. So if that's something you're considering, I would encourage it. If it's something that you're like, heck no, good for you, couldn't be me.
yeah, I also took 2 gap years. I know for me, I was freaking out about the idea of taking a gap year. I was like, oh, I'm gonna be so behind and all that jazz. But I graduated in 2021. So it was like still kind of like the COVID era. So I finished school, it was completely online still. And I knew if I were to start that next fall, mental health would be in the drain. So I feel like it's like every person's different. I know some of my friends who came straight from undergrad, they said if I didn't start school now, I don't think I would be motivated to like pick it up later down the line. I know for me, if I started school right away, I would be burnt out and I would not be doing as well as I am right now. So it's like you kind of have to evaluate and like as you're getting closer to graduation time, like junior, senior year, that's when you're gonna have to have like that talk with yourself, talk with friends, family, all that stuff to see like what fits best for you. But I'm very much pro gap year because that's also when I got all of my clinical experience. I started working as a technician at an outpatient, and that's where I learned like most of my tools that I have when I'm in my classes now. So
I'll just comment as the old person here that there was no such thing as a gap year. When I went to school, I didn't know that term, but I'm a huge fan of it from this perspective. You're so young, you have your whole life ahead of you. And if you feel like you want to take a break and work or travel, I see there's a question in here about traveling abroad. Definitely do that. I love to travel. It has enriched my life immensely. And yeah, Chloe might have more perspectives on that as well, because I think she holds dual citizenship. So yeah, there's just so many possibilities.
You have such a good memory. I don't know how you remember everything about your students, but Very impressed. But yeah, I agree. Like life is long, but life is also short. So like make the most of your time when we're young and have a little bit more flexibility. I also took a gap year for the same reasons. I just didn't feel ready, and I did also learn a bunch from an internship that I had during that year too. And yeah, traveling is just a great way to see other perspectives and just kind of get your perspective right about life and stuff, and be a little bit more motivated to go to school. But whatever floats your boat and is financially feasible too. And then internship wise, I did more like a lot of shadowing in different settings, and then working as a technician, like Maya said, at a few different orthopedic clinics, like in undergrad and then also in my gap year and a little bit during PT school, but that got too crazy. So yeah.
Awesome. Thank you all so much. The next question that was submitted was, what made you want to be a physical therapist over other health careers? And David, you kind of touched on this a little bit, but if you want to start us off again and maybe share any other insight you have.
Yeah, absolutely. So like I said, I was kind of going into three different things. When I was in high school, I screwed my ankle up pretty bad. Worked with an athletic trainer after they fixed me up. Thought that was really cool. So I worked for them all through college, but about halfway through, I realized that I didn't, the hours were kind of a lot for me specifically. Some people love it. I don't think I could do those kind of hours. Shadowed some neurosurgeons, thought I wanted to do med school. Didn't get in my first try. So I wound up picking up a job in a physical therapy clinic because it was what could pay the rent. And then when I applied to med school again, I realized I was like, a lot of these answers that I'm giving for medical school, I wasn't really, not that I was lying, but it felt like my heart wasn't in it as much. Didn't get in a second time, took a second gap year. And I realized that I had fallen in love with physical therapy day in, day out. All I could talk about was my PT patients. I mentioned them all the time in all my other applications. And I remember one of my physical therapists being like, why don't you just do this? You like it and you seem to be okay at it. So go do that. I think what really helps kind of, at least me, decide is another thing that the same mentor said earlier was, if you can handle the worst day of your career and still like the field that you're in, that's the field for you. Because at the end of the day, like, physical therapy is great. I love it. I would never do anything else, but you are going to have days where it's just a job and you have to be okay with that. And if you can't live day in, day out doing that job, then it's time to consider something else. And for me, that was switching from medicine to physical therapy.
Awesome. Maya, do you want to go next?
Yeah, I'd say I was kind of debating between physical therapy, occupational therapy, and also like hearing science. That was interesting to me too. I knew that I never wanted to go in med school. I was like, you know what? Maybe I can do that. But I feel like work-life balance is very important to me, and you have none of that in the like MD track. And I feel like with PT, it's just so fun and interactive with patients. And I kind of like fell into PT because I was interested in like medical science and sports med in high school. And then that kind of like snowballed into where I am now. My kinesiology degree set me up perfectly for this. And I just love learning about the body. I'm kind of a nerd. Um, but I just love what we do and like the direct impact that we have on patients. I think that's super cool. And I see results day in and day out, whether that's like their physical well-being, but also like I like that kind of mental well-being that we definitely play a part in, like motivating our patients. I think that's often overlooked, but I am always going to be everyone's biggest cheerleader. And I feel like we don't get that a lot in other healthcare occupations. Um, so I just think that's really fun. And I think work-life balance wise, like we have pretty feasible hours, I think anyway, that make it like possible to enjoy life outside of that. So
Hey,
Amazing.
can I jump in, Gabby, and just, this sort of builds on what Maya was just saying, which was lovely. I love to hear the student's perspective. But I'm just looking at the chat and I see this question about different opportunities within physical therapy. And then there's a question about internships and difference between PT and OT. And I think I can sort of address those together for a
Yeah,
minute, if
go
that's
for it.
okay. So you would never get bored in physical therapy because we work in so many different settings. Me personally, in my career, I've worked in the neonatal ICU within a hospital. I've worked in pediatric ICU, pediatric rehab, inpatient settings. I've worked in the school system. I've worked in home health. I've worked in Head Start programs where we work in small groups with parents and toddlers. Physical therapists work in emergency departments. They work in cancer hospitals. They even work with patients now at the end of life. So there are so many settings. You might work in a business. Physical therapists work in work hardening settings. So there are just endless opportunities for where you can practice as a physical therapist. That said, getting internships is a little tricky, unfortunately, in this post-COVID era. And again, I think the students can speak to that more. It's probably easier in an outpatient physical therapy setting than it is in a hospital, for example. So to go through the onboarding and the different security that you have to go through to get into a hospital, unfortunately, is much more difficult than it used to be. I'll just say one thing about NAU is we don't require that you have hours. Now, you'll want to do that. You want to know if this is the career for you, but you're not going to not get into PT school if you haven't been in a hospital. So there's different opportunities for that. And then real quickly, the difference between occupational therapy and physical therapy. So like I said, physical therapists really focus on movement disorders in general and function across the spectrum of somebody's life, how they function in their home, how they function in their community. Occupational therapists are very focused on occupations. That's why it's called occupational therapy. And so they're addressing movement dysfunction from the perspective of how it impacts directly on somebody's occupational roles. Sometimes people will say, well, occupational therapists work with the hands and physical therapists work with the legs. That's a really, really general division. I would say it's much more nuanced than that. Sometimes PTs and OTs will work together with patients. An occupational therapist might do hand therapy, and so might a physical therapist, but with different goals. So you should explore that more if you think you might be interested in OT. For sure, go on the American Occupational Therapy Association website and look at the definition of the roles, and do that for physical therapy. You can go to the American Physical Therapy Association website and get lots of information.
That's great. Do you also want to answer this next question, is how do you become a PT?
Sure. So you do have to have a bachelor's degree. The degree for a physical therapist now is a doctor of physical therapy. It's a professional doctorate like an optometrist or a podiatrist or an MD, essentially. Our program is a 96-month doctor of physical therapy. Programs in the United States run anywhere from 2 to 3 years to get the degree. You apply. Most programs use this central application process that we call PT-CAS. Some schools don't use that, but I'm pretty sure that every school in Arizona participates in PT-CAS, which is where you would apply. You can have any major as an undergraduate student. Doesn't matter what your major is, it just matters that you have the prerequisites that are needed to apply to a physical therapy program. And the students, you can maybe help me with this, but those are chemistry. So chemistry 1 and 2 with a lab, physics 1 and 2 with a lab, biology, anatomy and physiology, psychology, statistics. I think there's is that everything for us? They're a little bit different from school to school, but those are, I think, the ones for NAU. We require students to take the graduate record exam. We don't look at a minimum score for that, but we do want to see that you've taken it. There's sort of a character assessment that we're using now. So that's also an online test that students take. Trying to think. And again, you don't have to have clinical hours, but some exposure, it's really to your benefit to do that. And again, students, if you want to add anything that I should be saying that I've missed, please jump in.
I feel like that about covered it. Yeah, since it's nice not having the requirement of hours, but that's kind of how you know, like, okay, I'm not just gonna go to school. What if I hate it? Like, if you have some kind of observation hours, it kind of confirms whether or not like this is gonna be a good fit for you. Um, I know most of my hours came from my job working as a technician, but I have some friends who, since they weren't able to get like inpatient hours specifically, it's just reaching out saying, hey, can I come shadow you? Just see like what do you do in a day? What does a PT do? Um, and I don't know that we had a lot of people do like structured internships. I know for me personally, my internship got canceled because of COVID. Um, so it's just kind of like finding your own hours with that. But then as far as like getting into school, I think you covered all of the requirements, Dr. Bosch. So
Thanks. And I'll follow up too. There's a really good question. What's the difference between a DPT and a PhD in physical therapy? So the doctor of physical therapy is the degree that's conferred to be licensed to practice as a physical therapist. So again, by getting your degree, it doesn't mean that you can go practice. After you finish your schooling in an accredited program in physical therapy, then you have to sit for a licensure exam in the state that you will practice in. A PhD is a research degree. So I got my PhD after I had been practicing as a physical therapist for years because I became interested in research and had the opportunity from people that I was working with. So that is not necessary to practice as a PT. And in fact, you could not get licensed as a PT if you have a PhD, even if it's in rehab sciences. You have to have a DPT first.
Awesome, thank you. This next question will be for the students and is how is the workload of being a PT student and going to school? Do you have any jobs and anything extracurriculars outside of school?
Yeah. So the workload is it's grad school, so it's a lot. You do a lot. It's not necessarily like easy because again, it's grad school, physical therapy. You're getting a doctorate. There's a lot of anatomy. It's blurred right now, but that whiteboard is full of all of the origins and insertions. I can't remember, but it is manageable. A lot of it is going to be on you. It's learning your study habits. It's learning how to connect with people. We have a group of us that pretty much at any hour of the day, it's like, hey, we're going to get together. We got to talk about this, that, and the other, especially with how hands-on physical therapy is. Like I mentioned earlier, we have a lot of open lab time. It's not going home right after class, even though you might be kind of dead, and staying back and you're like, okay, do I know how to mob a patella? Do I know how to put you into traction? Stuff like that. So it's a lot, but it's very manageable, especially if you work with others. Something that Dr. Bosch said first week that really stuck with us is as physical therapists, you are not competing with each other. You work together, not just in school, but in the field too. I remember when I was working as a tech, the PTs were constantly bouncing ideas off of each other. And so you get that started early and it makes it a lot easier.
I echo all of that. I feel like it's definitely manageable if you want slash need to have a job. I think my biggest precaution would just be make sure you're somewhere where you have a lot of flexibility. So I was actually able to like stay onboarded with my technician job that I had prior to starting school because they understand the flow of grad school and how like intense it can be. And so I just give them my availability. It changes obviously each semester. And I just say, hey, like now I have availability some Wednesdays and some Friday afternoons. So I just say, let me know whenever you have or need like coverage and whatnot, and we can make something work out. I know classmates have jobs on the weekends, like serving jobs and stuff like that. They just work once a week or so. So it's doable if you need some extra cash or, you just want like a break from school. Maybe that will be a good outlet. Uh, but I think the workload in general is manageable. There's going to be hard weeks like right now. I'm in the middle of midterms. Kind of stinks. It's just been back-to-back exams for like 3 weeks now. Obviously, you're in school. Like that's going to happen. Um, but I think overall in general, it's planned out so you have time to study. It's not just you're in class all day, every day. There's like there's study time kind of built in. So that's nice. And I know that like outside of class, I like to stay on campus, study with friends or alone. Because as soon as I go home, brain is shut off. So I like kind of make it a rule for myself, keep school at school, and then home at home. So I think just finding a good balance with that, and it's tricky to find that balance. It took me like a semester to like get that worked out to like a good schedule, but it's definitely doable. I feel like I have a lot of time to enjoy myself, and it's not just like go, go, go all the time.
That's great. Thanks for sharing. There's a question in the chat. Is there a different route for sports medicine? How hard was it to get a job? And can you have flexibility to travel? And is there such thing as a travel PT? So I'll open this up to anybody.
Yeah, when you ask about a sports medicine route, you can specialize in sports medicine as a physical therapist. You can find a job in that kind of setting, but you can also do a residency in sports or a fellowship. Those are future opportunities for kind of career advancement or specialization once you're a DPT. As far as difficulty getting a job, I mean, maybe if you want something in a very niche area, it might be difficult, but there are so many opportunities for physical therapists. It just is not an issue. It's easy to get a job. And yes, there are travel PTs. So that's an opportunity as well.
Awesome. Thank you. The next question that was submitted was, and again, this is open to anybody to answer, but what is the most important thing beyond actual classes and grades when it comes to applying to PT school?
That's a tricky question. I feel like the like application approach is very holistic. It's not just like, okay, are you like a 4.0 student or like, I don't know, some kind of high GPA student. I think if you're low in one area, obviously there's minimums to GPA. I think it's still like a 3.0. But if you're struggling maybe in the academics, make up for it with your personal letter that you have to write on the application. Make up for it with good letters of recommendation with from a professor that you know as well as a PT. Make up with your observation hours. So like it's okay, you're not going to be perfect at everything. Like nobody is. So just find a weak spot, identify it. You can mention that in like your interviews and you can mention that in your like personal essay, but then make sure you have a few strong spots. So it depends person to person. Um, but they're not just gonna like grill you if you don't have perfect grades, or maybe you don't have all the observation hours, but you're gonna be strong somewhere else, so just highlight that.
Awesome, thank you. And it looks like there's a couple more questions in the chat. These are great questions, so thank you for adding them to the chat. Oh, awesome, thanks, Pam. And how does a travel PT work?
So yeah, I kind of tagged that on at the end. You would sign on with a company that hires travelers and they would place you in different cities. So I had a friend who did traveling PT for several years and she had practiced in Phoenix for a while. She left, she went to different cities throughout the US. She went from the East Coast to the West Coast and she ended up doing a rotate or I guess a stint. She worked for this company. She was placed in a hospital in Seattle, loved it, and ended up finding permanent work there. So she stopped traveling once she discovered the city that she loved. Yeah, so it's a company that would place you there.
Awesome. And then a follow-up question is, what is everyone's favorite specialty if you have one? Or is there fields of specialty that you're looking to go into? And we'll start with Chloe.
That's a tough choice. I do really enjoy home health because of the wide variety of patients that you see, so it keeps it like really interesting. I also really enjoyed outpatient neuro, which is usually for patients that were once most likely hospitalized, whether like recently or years ago for, say, like a stroke or Parkinson's or various neurological injuries. And then you're just helping them get back to their day to day. So sorry. So sorry. That's my dog. Kona, it's okay. So yeah, that's my favorite. And Kona's too, apparently.
That's awesome. Thank you. And David, I know you're a first year, but do you have any idea or something that you're really interested in right now?
Oh man. I love sports, so sports medicine is something that I'm potentially looking at. I also, like I said, I shadow neurosurgeons. I've had a heart for neuro for years. I think the coolest thing is that you get in here and you realize you don't know a lot and you know a lot, and then you know a lot in the middle as well. So ask me again in 2 semesters. But right now we're looking sports or neuro, maybe. I don't know.
Awesome. And then Maya.
I didn't know what I wanted to do coming into school. I was like, I know I like this. I have seen a few settings. But now that I'm into kind of like the more specialized classes, I'm really loving neuro. I had a neuro rotation as well, just a few weeks ago. It's just fun. It's an interesting population, and I think it's super cool and like completely different to my ortho background, where like most of the people that I was seeing were like older people who had joint replacements. You can only do so much with the joint replacement. So like outpatient ortho, I've seen it, and now like with neuro, I think it's super cool that you can have the same diagnosis. Somebody could come in with a stroke, but you have a bajillion different presentations of like how the patient will look. I think that's kind of cool and like challenging for me. It makes it more like fun for me to like figure out how to help each individual. I also we just started a cardiopulm class, and that's kind of fascinating. Cardiac rehab is kind of piqued my interest right now too. So who's to say? I don't know. I hope I figure that out soon though.
Awesome. And then Dr. Bosch, did you have a favorite specialty or still have a favorite specialty?
Definitely neurorehabilitation. And again, across the lifespan, children and adults. It's just amazing the neurological dysfunction that affects people, whether it's through disease or a traumatic accident, and how important it is to have physical therapists to help people maximize the quality of their life.
Awesome, thank you. And then Jared, I'll be in touch with some resources if you need some help with your progression plan on how to get that path going. And then Mackenzie, your question is, how do I get involved or start with a pathway for more sports-related PT?
I
I
would
guess
Oh,
that would be a case where you could really try to connect with someone in your community and see if you can shadow somebody. Certainly if you know someone, that would be a good start. I mean, that's probably the best I can offer. I'm not thinking of anything else unless you guys have other suggestions.
Because I said I worked in athletic training, I would say that that's probably a way to kind of get into sports as a whole. But you have to have that caveat in the back of your mind the whole time that they're not the same job. I worked for athletic trainers, I worked for PTs. It's starkly different in a lot of ways. You kind of do some of the same stuff. But like what Dr. Bosch said, I would just start emailing people and stop when someone says yes.
Perfect. And then kind of to just wrap us up here, we'll go through everybody. And the last question is, what is one piece of advice that you've taken with you throughout your career that has really made an impact on how you go about your life? And we'll start with David.
I have to text the guy that I keep quoting today. I remember when I got denied from medical school my second time, I was really kind of hurting. There was really nothing, whatever. And I realized I wanted to do PT, but I was kind of scared at the whole concept. And my favorite quote from him ever is, "Your heart will take you farther than your brain will." So if you have a passion for something, if you have a desire to do something or go somewhere or be someone, um, understanding that there are going to be days where your brain fails you. Like I had a practical today, and halfway through, I completely forgot what I was supposed to ask this guy. And then I got out, and I was frustrated with myself, and I just realized that like this isn't the end all be all. There are going to be days where you have brain fog. There are going to be days where you don't know what you're doing. And there's going to be days where you feel like you did it all. I mean, I can't experience this, but like 20 years down the line, you're a PT, you've been practicing for years, and you're going to have a day where it's like, oh, I have no idea what I'm doing. You do. You just have to remember that there's more in here than there is up here, and you just have to get through it.
That's great. Thank you. And then Maya.
I really like what David said, and I feel like for me personally, I have always been so hard on myself. It's just like, okay, well, you have to do really well on this exam, or like, don't sound silly when you're talking to your like patient in these simulations and stuff. And I think you kind of have to have like the memory of a goldfish. So you're just like, you get through the task and then just forget about it. So, like, so what if it didn't go perfect or how you wanted it to? That's fine. You're still meant to be here. Like, you're gonna be okay. You're gonna pass these classes. You're gonna be a great therapist. Like, I think we get so caught up in the idea of, because, like, in undergrad, it kind of is about like you're trying to achieve these high standards. But once you get into PT school, you're not competing against anybody. Like we're all going to be on the same team, learning together, growing together. Nobody cares about your GPA or your class ranking or any of that stuff after you graduate. Like it literally does not matter. They won't look at your transcripts. And so I think that was like a big mind shift for me that I had to like work through. And then I finally had a breakthrough this summer and I was like, you know what? I don't need to be over stressing about this. And I'm still performing really well, but now I don't have that stress and like that voice in the back of my mind saying like you need to do better, try harder. Like I am where I'm meant to be. My professors are fantastic and they help me with anything that I need at any time. And I have like 49 other people that will also help me other times. My classmates are like my lifeline at any time. And so I think my biggest advice is like treat yourself with grace and like it's okay to make mistakes. We just have to like learn from them and then just move on from it. Like you will be okay.
That's great. Thanks for sharing. And then Chloe, do you want to go next?
Sure, thanks. I would say I mentioned this earlier on in the panel, but to just have fun with it and enjoy and try to go into it with the curious mindset. I just think undergraduate time was more stressful for me than graduate school or being a PT now. It was just like all the different choices and decisions and like all the pressure to pick a career. It was just so stressful and you're just figuring out so much about like being an adult too. So just try to enjoy it. And if you're like overly stressed, you're not going to learn or like take in much information anyway. So just do something to kind of unwind, learn about yourself, what makes you feel less stressed, and then you can attack the problem later. It'll probably take you less time. But yeah, just enjoy and find your passion. Hopefully that's PT. That'd be cool.
Thanks for sharing. And then Dr. Bosch, do you want to close this out with your piece of advice?
Thanks, Gabby. I love listening to you guys. It makes me tearful. Good insights for you to share. Thank you. I would say be open to feedback all the time and just really lean into it. Let yourself take it in and not take it personally, like I'm a bad person, but listen to what you can get that's helping you to be better, because you will get tons of feedback in PT school, first from your professors and then from your clinical instructors. And it's not always delivered in a way that you want to receive it. So you have to really tune out the tone sometimes. You know, they're doing their work and they're people too. And it doesn't always feel good, but sort of like what Maya was saying about the goldfish, I like that. Just take it and then move on. But maybe use it, you know, to improve yourself, but not take it personally to feel bad about yourself. So be open to feedback, whatever you choose to do next in your career path. But I also hope that it's physical therapy.
Awesome. Thank you all so much for your valuable insight. I hope it was helpful for everybody. And thank you all for your time tonight. I'll be in touch with the recording of the session and then also some helpful resources that might be beneficial to you if you're interested in PT. The NIU DPT has a great Instagram page, so I'll also send that their way. And it's a great way to see what the students are up to, both in Phoenix and in Flag. Thank you again so much again for your time and have a great night, you guys.
Thank you. Bye-bye.